have a neurological tic in my neck. It gets worse when I'm stressed or I'm tired. Just kind of like my head starts shaking and I can crack it on one side but not on the other. And I have some wrist pain that's relatively new, but I also have shoulder pain, which is has been going on for a while longer, mostly in my right shoulder. And I know I have flat feet, but I also have some pain in my left arch right now, and some postural issues.
All right, got it. So how long that neurological tic been going on?
At least since high school, so that would be like 8 years or something, 9 years.
8 to 9 years.
Yeah.
Got it. Okay. And what about the neck pain? How long that's been going on?
That's kind of, I think it's connected to the tic, because it hurts when I do the tic.
Got it.
Sometimes it like closes up, twitches.
Okay, so here's the deal. Okay, so now we're talking about your neurological tics, the neck discomfort. Okay, the right wrist that's been an issue, both flat feet, and we're going to connect all the dots. So there's 3 structural abnormalities we identified on here. Okay, but the major one that set everything all off from the very beginning is this 5th lumbar right over here. Okay. So why don't we take a look at this all the way down here, even though you have no pain there whatsoever, is because this. Okay, so if your foundation is nice and strong and stable, everything else above it is going to be strong and stable. Unstable foundation, everything else above it is going to be unstable. So if you take a look over here, this is nice and this is what normal is supposed to look like, nice and straight. Does that look straight to you?
No, it tilts a little to the left.
Right. So in other words, right now your body, what it's doing is curving this way, does another curve this way, and then it curves a little bit this way and curve that way again. Right. So why is it doing all of that? All response to this structure right over here. So that bone, what it's doing right now is, I want to see in the center line. However, what it's doing is, went all the way to the left and tilted over this way. So that's where all these bones are following. They're just following along whatever the last bone was doing as well. Okay, so that's why we see this arc going on. Okay. Now, however, because our head has to be level and straight, if that body did the way it does this way and did this way, we'll be going all the straight this way. But no, our head has to be here. So what happened is everything started compensating and rotating to keep this noggin nice and straight. So that's why we see all these little compensating curvatures going this way, that way, so on and so forth. Right? So there's 3 structural abnormalities, but the major one started all off is this 5th lumbar over here. The 6th one is also we need to correct as well. More like we've got to verify and check, see if this needs to be corrected. Okay, and also this first dorsal vertebrae as well. Okay, now everything else in terms of your neck, okay, actually it's very good condition. Now even though you feel neck pain over here, I don't see any structural abnormalities over in that area. Right. So these areas, I want to take a really close look at, see if they need to be corrected. Right there. We're starting with stand-up palpation. We're checking for any swelling, edema. And this part over here, there's quite a bit of swelling. Should be nice and smooth over here. You feel that? It's very boggy on the left side over here. Okay. Not so much on the right side. But over here, there's a lot of edema going on here. Okay. Next part we're going to check is motion of a patient, see what's moving, what's not moving. It's a little bit stuck on that sacrum over here. Hit not too bad. But right there, that 5th lumbar. Oh, that right there. Tender, right?
Yeah.
Yep. Tender right there, huh?
A little bit, yeah. Oh, yeah. Ow.
Yeah, this one's not moving.
Ow. Ow.
Yeah, that's a 6. Tender right there a bit?
Little. They crack a lot.
I understand that. You're already demonstrating some tics. It's like it's not smooth, steady, tilting your head towards the right.
It feels stuck.
Right, it's
choppy.
Right. Your neck is stuttering a bit.
Oh.
Okay, so all the structures in your neck is fine. Okay. Now, because you're flexible, that's why I need to stretch you a little more. Okay.
Yeah. Oh.
No. Okay, walk around a bit.
Feel a little bit dizzy.
That's very common.
Okay.
Because we change your center of gravity.
Yeah, it feels very different.
Different in what way?
Like I'm standing more on my feet.
Good.
Which
that something?
should happen, obviously, normally.
Mm-hmm.
Yeah, it feels like I don't have to like flex my muscles in order to have a better posture.
Good. Yeah, that's what I think we set this
Oh.
right there.
It feels like I'm more straight up and down.
Well, the reason why, okay, you feel a lot more straighter is because this 6 dorsal vertebrae, you notice how everything's like leaning towards that way, towards the left?
Yeah.
Like this way. So what I did was, for this 6 dorsal vertebrae, I realigned that on the 6 dorsal vertebrae. That's why it's much more upright. That's why we feel your neck and everything else more upright.
Yeah.
Okay? It does so, right?
Yeah.
Yeah. Okay. Just relax right there. So before, your head and your neck are making a lot of tics while it's tilting your head towards the right. So let's see if it's... How do you like that?
Oh.
It's much more smoother.
Yeah.
You're not doing those tics anymore. Okay, with the elbow over here, the radius is fine. However, what I'm seeing here is increased joint space over here. Okay, and the reason why is because this ulnar bone, okay, that's stuck and is not moving right. That has been misaligned. So this is the one I want to take a much more closer look at. Okay, this is rotated badly on the lateral side. So over here, we're gonna take a look at. Now, we checked. I understand you're experiencing pain and discomfort in this wrist over here.
Yeah.
Okay. So when I check it, okay, this should move up and downwards without a problem. This ulnar bone, okay, you feel the difference here? It's too wobbly.
Yeah.
It's way too loose compared to your left. You feel this? It's much more stable. It's not as loose as compared to the right side. Okay. This one over here, you know, it's like right. It's like flapping in like a piece of paper in the wind. Okay. There's way too much movement in here. So the reason why there's too much movement over here, this is your body's way of compensating. Meaning, if something's stuck on the elbow, okay, because the ulnar bone is from this point to this point over here. Okay. So from these 2 points, if one side's stuck, the other side will move a lot more to compensate. So since this is moving way too much, the problem's actually here. Even though you don't experience any pain here whatsoever, that's where the problem is, right? Tender right there?
Yeah, I feel it in my fingers, actually.
Exactly. This is swelling right over here, right on the spot. This is between your humerus and the ulnar. Okay, your radial head's right over here. So this ulnar over here is misaligned.
Oh, yeah, it's tender there.
Exactly.
Yeah.
Whereas over here, see, it's nice and flat. I don't see any swelling. Not a tender, not even close, other than my finger pressure in there, right? So, we already identified, so this is the one we need to correct.
Yeah.
There we go, right here. There. A little more.
Oh, yeah.
Feel that difference now? It's not as, hypermobile as much. The left foot, even though you have some flat feet over there, what I noticed, it's not as bad as your other foot. This one over here, what I've noticed more importantly is the talus over here, it's a little bit elevated this way. So this one's anterior superior, this is what we need to correct, and that's why you see all the other structures in your medial arch has collapsed. That's why this you see over here is sunken in. I want to see this nice and level like this. But see this ditch going on over here? All collapsed from this. Okay, so that's what we need to correct. Now, with your right foot, okay, this one we got other things going on. The talus is not too bad. There's some compromise, but what I notice here more is you have an inferior navicular. This is the navicular bone. I want to see it again. That's a straight. However, with this bone, what it did was it swiveled downwards. And that's what we see here. Is much more protuberance on the bottom part. In other words, it's more prominent, more sticking out here. And also the first cuneiform, same deal over here as well. Okay, it went downwards. Okay, that's why you feel this one more fixated, more stuck. Doesn't move too well. So that's what. So these two, we take a closer look, see what's going on, see what needs to be corrected in that one. Feel the difference over here? Okay, this is the navicular, and this is the first cuneiform. Feel that bony part over there?
Yeah.
Feel it over here?
Yeah.
It's not as pronounced versus your right.
Oh, wow, yeah.
Feel the difference now, right? So this one over here, these two we need to correct, but I want to correct this navicular first before we go after the first cuneiform. Okay? That's it. Walk around.
Yeah, it feels like the left foot.
Feel the difference in that arch now?
Yeah. Yeah, it's all in the arch. It feels like I have more space in the arch.
Good. There it is. What's different you noticing with your feet right now?
Well, my right arch doesn't feel like there's something hard in it, like
Good.
I guess the bone was there. And the left foot feels, the ankle feels like I have more mobility, flexing and pointing.
This is not an overnight thing.
Yeah.
In order to restore the arches, okay, and those, especially with severe arches like I've seen in that one, okay, this is approximately 9 to 12 month project. Okay. That's exactly right. So we not only do we need to correct this fifth lumbar, the low back, we have to restore the nerve function to both of your feet, and at the same time correct the feet while we're at it. Okay, you give your body the time it needs to rebuild those arches. So it can be done. It just needs time.
So it's a little better. I feel like at least my lower back is more relaxed, especially if I concentrate on relaxing it. I feel like it relaxes more than it used to.
Good.
My neck isn't shaking too much anymore, still slightly, but not as much as before.
Good. So those neuro tics is not as pronounced and bad as it's used to?
Yeah, and I do feel more space in my right foot arch.
Nice.
So, yeah,
Okay.
I don't feel bone sticking out. So the neural tics are basically gone. I'm a lot more relaxed in my shoulders, and my elbow and my wrist feel a lot better. I was, at the beginning I was having trouble like opening doors. It really hurt, and twisting jars. Yeah, I feel like I can straighten my arms a little bit better. Still not completely, but a lot more than I could before.